Welcome to you.
Good to be here.
We're going to talk about blood pressure today. And
Right. Well, first of all, pickles are not good if you have high blood pressure.
No, that's all the salt.
They're filled with salt.
Yeah, I know.
Well, the problem with high blood pressure is, among other things, you go into the doctor's office. Are you ever anxious when you're at the doctor's office?
Yeah, of course.
It's the white, what do they call it?
White coat hypertension.
There you go.
So your blood pressure may be up. You may need something to do that, to basically take care of it, or it may just be a sampling error. So I recommend anyone with high blood pressure get a good high blood pressure cuff and measure it at home and bring that information in when you see your doctor. It's very important. It's estimated that about 1/3 of the people with high blood pressure on medication are actually not taking enough medication, enough that they actually need to treat it. And one reason is people don't like to take multiple pills. Sometimes it takes 2 pills, sometimes 3 pills, and people go, I just don't want to take those pills. It's too many pills. What do you mean it's too many pills? Do you want to have a stroke? I mean, that's really the bottom line. We have dropped stroke by 70% since I started medical school, and that's a long time ago. But yeah, a long time. I'm an old guy, let me tell you.
Did they have
in the 30s?
Did they have pills back then?
No, I'll tell you though, FDR died at 64. His blood pressure was 300 over 150.
What?
There were no medications for high blood pressure. We didn't know how important it was. It was only in 1974 that we understood the importance of treating high blood pressure. 70% drop in stroke, mostly from the treatment of high blood pressure. We could do a better job if we measured it right and if people took their pills.
And don't measure with your legs crossed.
No, that's right. Well, what you do is go to Google and do American Heart Association, AHA, how to measure your blood pressure. Go to YouTube and look and see how to measure it correctly, and you'll get the right tips. But get a good cuff. I recommend Omron, O-M-R-O-N. They're a very good company. They cost about $35. You don't need a fancy one, but their particular blood pressure cuff is really good. And if you've got an old one, throw it out. If it's more than like 5 years old, it's not
really?
good.
Really?
It's not new technology. It's not as... Do you have one at home?
Yeah,
How old is it?
I don't know. So what numbers? What are the good numbers here?
Basically, you really want to get it to about 130 over 80. That's ultimately your goal. 140, if it's over 140 and it's over 90, you have high blood pressure. But the reality is the closer you get to like 130 over 80, the better off you're going to be.
So other than medication, are there other things you can take, like fish oil?
Don't eat pickles. Don't eat pickles.
Fish oil?
Don't eat a lot of salt. The way to really reduce high blood pressure is with exercise, eating right, a more Mediterranean diet, reducing weight. If you're overweight, it's more likely to produce high blood pressure. The usual things that make us feel good and make us feel better actually will reduce your blood pressure. But about 60 to 70% of the people over the age of 65 have high blood pressure, and it's just a function of life. When we get older, the blood pressure just goes up. Yeah, but measuring it at home is what makes a difference, because the measurement in the doctor's PA or nurse practitioner office, you're anxious. Even I'm anxious, and I'm a doctor. I go in there and I sit there and I go, be relaxed when taking my blood
Doctors
pressure.
make the worst patients. I know this.
Yes, they do. How do you know this?
My dad, my physician, worst patient ever.
My doctor, when I got there, the nurse did it, but then at the end, the doctor did, because I've been there and relaxed.
No, and that's exactly different. Right. You get a couple of
And they said, if you have one at home, just measure it for a week and let us know what they are.
And if you're not sure if your blood pressure cuff is accurate enough, bring it into the doctor's office, have them measure it, and then you measure it with your cuff and see whether or not it's in the same realm.
That's calibrate it, that sort of thing.
And calibrate it, yeah, exactly.
Okay, I have to ask you about vitamin D.
Yes.
We know traditionally Wisconsinites, we have pretty poor vitamin D levels because of the lack of sun. So what do you do if you are outside all the time and you're still traditionally low level of vitamin D?
That's what you do. Because the reality is we now know vitamin D is even more important than we ever thought. It's not just related to rickets, which we wiped out by putting vitamin D in milk in children.
Rickets?
Rickets. That's right, rickets.
When you started.
There was vitamin D in milk back when I started. No. That was back in 1900. But we know that taking 2,000 units a day is good. And the reality is, for some people, even if you go out in the sun, you're not going to get enough vitamin D. And the other reality is, if you have too much sun on your face, on your body, and you're wearing sunscreen, you're not going to produce that much vitamin D. So the answer is capsules. 2,000 units a day, and if you don't do that even once a week, if you take them all at one time, take a larger dose of 5,000 units.
If you have too much vitamin D in your system, does your body just eliminate, or?
To an extent. You can't get too much unless you start taking... Well, if you take very high amounts.
Okay.
If you're taking 50,000 units and you're taking it too often, you can take it to build up your vitamin D. The answer is yes. There's vitamin D toxic reaction, but that's taking an enormous amount. It's not a small amount.
All right.
Okay.
We're out of time.
Yeah.
Zorba, good to see you.
Good to see you guys.
And
Happy
Thank
summer.
you.
Happy summer. Get
And
ready for
enjoy
the
your pickles.
Get ready.
Yeah, enjoy your
I'm
pickle
gonna go have
wine.
some tonight.